Hi everyone, I am Maria Bernadette R. Legaspi, your instructor in MLSP 112, and naniniwala sa kasabihang seek to be worth knowing rather than well known. So ayan, bago tayo pumunta sa ating topic, mag-share muna ako ng isang trivia question. So sabi dito, what word do scientists use to describe unit of measures that is also the name of an animal? Guess what? Ano kaya? So, the answer is mole. Ayan, 'di ba? A mole is also an animal. And mole is also the measures. Ayan, of unit of measures. So, ayan, for today's discussion, we will be discuss the phlebotomy solution and present the order of the vein. And this is the following of the standard of CLSI. Ayan. Ayan, ano nga ba ang ating tatalakayin? So, under ng phlebotomy solution, andyan ang order of veins such as median cubital vein, cephalic vein, and basilic vein. So, ayan, ano nga pa muna ang definition ng phlebotomy? Phlebotomy is the removal of the blood from the body, and therapeutic phlebotomy is the preferred treatment for blood disorder in which the removal of the red blood cell or serum iron is the most efficient method for managing the symptoms and complications. Let's just take a look at the order of the veins. Just like the order of the vein, there is an order of veins that we need to follow when we were attempting to draw blood. So as you can see, we have three major veins. We need to take a look at the first is a median cubital vein. This is a primary vein we should be looking for when inspecting an arm. And second, if the median cubital vein is not accessible, then this is the time that we should look at the second is the cephalic vein. And now, if the cephalic vein is also not accessible, then we should take a look at the last. So, what is the last? This one is the basilic vein. Basilic vein is always be considered last when inspecting an arm. Now, if all three veins are not accessible on the arm, then we need to take a look at the back of the hand. Now, the back of the hand have veins are referred to as the dorsal metacarpal veins. Now, there is no specific order to drawing hand veins. Whatever vein you feel comfortable with, we're inspecting the dorsal metacarpal vein on the back of the hand. Then you can attempt to draw any one of those veins. Now, when we're looking at the area to draw, we must remember that this area is called the antecubital fossa area. This areas where all three veins lie the median cubital with the cephalic and the basilic vein. Now, I recommend or I highly recommend to follow this order. First, look for the MTG cubital, then the cephalic. And then, of course, the basilic now. If those three are not accessible again, we go to the back of the hand of the veins, which are referred to as the dorsal metacarpal veins. Then, with a door come in carpal veins, we can look at the rest area. Or where do you watch? Or where your watch goes? O kung saan man nakalagay ang inyong mga watches. Now, this is the standard order we should follow when inspecting an arm. Now, my recommendation is if the median is not accessible and the cephalic is also not accessible, I would definitely skip the basilic vein and go back to the back of the hand or the wrist area where the watch goes. And in a minute, we're going to see why that's important, that when selecting the basilic vein should always be last resort. If the back of the hands and the wrist vein are not also accessible, and the final note there is no forearm drawers or inside the wrist drawers, that is against the standard of care. And again, foot drawer or only with an empty approval. So, If there are no veins located anywhere in these areas, including the back of the hand, the wrist, then we would get an MBA approval for foot, okay, for foot only. Through, and again, the form is not to be considered or inside of the wrist. So, as I mentioned earlier, the vein we need to avoid or even make an attempt on completely left is the basilic vein, okay? Now, the reason for this just because it is near to break your artery. In fact, the brachial artery runs just underneath the basilic vein. So, if you put two fingers over the basilic vein area, you should feel a pulse, no? If you push down hard enough and wait, that is the time to break your artery, no? You want to avoid the basilic vein because it's a higher risk of puncturing the brachial artery. And in fact, we want to avoid the internal bleeding that occur if we do Tank's herd, that brachial artery. So again, the basilic vein is the last resort positive or last option, last resort positive if all other grades are not accessible, namely MTG, cubital, cephalic, to back of the hand. The wrist, then the basilic vein can be looked for. If nothing else is available again, you want to avoid doing any kind of harm or damage to the patient. Also, there are nerves that run parallel with the width of the basilic vein that we're not careful of. If we are careless or not careful, we might nick or hit with a needle. Can cause nerve damage. So, we have a possible high risk dito over two arterial puncture and also hitting a nerve or doing nerve damage while trying to access blood from the basilic vein. So, again, this should always be attempted last when all over veins are not accessible for being punctured. Ayan, malapit na tayong matapos. So, in conclusion, the first thing first is always follow the order of veins when inspecting the arm. The median-cephalic and the basilic. So, di sabi dito, veins when inspecting the arm, the median-cephalic, and facilitate. This is affecting both the right and the left arm when attempting or being punctured. Second is always select basilic last. Ihuli daw ito. When all over veins including the hand are not available to draw, so avoid artery puncture. So this one is to avoid the nerve damage. So, this again, avoiding an arterial puncture and possible to nerve damage. Now, the last is the back of the hand has no vein order when selecting. So, the wrist is the part of the back of the hand. So, nerve draw the forearm or inside the wrist area. So, the dorsal metacarpal vein have no specific vein order. Whatever vein you find, the back of the hand for comfortable drawing, then make your venipuncture attempt on that vein. And again, never draw the form or inside the rest area. That is against the standard of care. And of course, if nothing is accessible on both arms or the hands, and then the foot can be considered. But again, take this note, okay? With MD approval first. So, ayun lang for today's discussion. And thank you for watching, everyone.